Part D. Just remember D for drugs. These plans are covering your outpatient prescriptions, the prescriptions that you are taking on a daily basis yourself. You could have a standalone prescription drug plan or one that's part of a Medicare Advantage plan. Now these are voluntary. Voluntary. You do not have to have a drug plan. But if you don't have a drug plan and you don't have other credible coverage, such as group insurance, retiree coverage, the VA, if you qualify for the VA, you have to be enrolled with them. You don't have to use it, but you have to be enrolled. And then you could avoid the penalty. Now the penalty is 1% of the average national premium for the year, which is 34 cents a month, not life altering. For a year, if you were without a plan, that penalty would be about $5. But you keep the penalty for life. So you enroll in a drug plan next year and the premium might be $15. Well, because you have that $5 penalty, you're going to pay $20 a month for that plan. But the following year, you change your plan and it's $30 a month. Because you have that $5 penalty, you're going to pay $35 a month for that plan. It stays with you for life. We've got clients that have never had a drug plan because they either don't have any drugs or they have very low-cost drugs. They're just risking it. They're just assuming more risk in that situation. We've also got clients that have a drug plan even though they take no medication, just in case. They don't want to take the penalty, and if they're put on something, they might have coverage. The reason I say they might have coverage is because every plan is different. I believe in your area there are 23 plans available. Every one of them is different, and they all have different formularies. So no plan is covering every drug. Now if Medicare could make any part, or the government could make any part of Medicare confusing, it's the drug plans. They all have the same structure, whether they're standalone or within a Medicare Advantage plan. You've got a premium for your plan, and you've got tiered co-payments. Now the plans can choose to have a deductible or not. If your plan has a deductible, you're going to pay full cost until you have met that deductible. This year the maximum is $400. At that point you go into the initial coverage. Here you're going to pay co-payment for your prescription. In our example, your co-payment is $10. But it's the full cost of the drug that determines when you move, if and when you move into the next phase. When your full cost reaches $3,700, you move into the donut hole or coverage gap. So your $10 copayment is for a $100 drug. It's the full $100 that is applying to that $3,700 threshold. You can think of it like a bank account. You've got $3,700 in there. Each time you fill a prescription, it is chipping away at that amount. When it zeroes out, you're moving on to the next phase. Or you could think of it like you're making deposits. You're going to deposit $100 every time. And when your account reaches $3,700, congratulations, you're moving on up. You're going to move into the donut hole or coverage gap. Now here, you're still going to pay a copayment, but you have a higher cost sharing. You're going to pay 40% of brand names and 51% of generics. So with our $100 drug, we're going to say it's a brand name. So you're paying $40, you're going to pay a $40 copayment for that medication. $10 for it to $40. Now the manufacturer is giving a discount for that of 50%. And then there's another discount of 5% in there that is helping get you out of the donut hole. When your cost goes from $3,700 to $4,950, that is when you move into the final phase of the drug plan, which is catastrophic coverage. Here you will pay no more than 5% of the full cost for the rest of the year. Getting into the donut hole, it is 100% of the cost. To get out of the donut hole, it's 95% of the cost. It's kind of an unfair trade. 100 gets you in and 95 gets you out. Now, a part of the Affordable Care Act is shrinking this donut hole so that by the year 2020, there is no donut hole and you pay no more than 25% all year. If they fully repeal the Affordable Care Act or they don't replace it and have something similar, this will revert back to prior to 2010, where when you are in the donut hole, you will pay 100% of the cost. So this has been a very positive change for the Affordable Care Act and the Medicare beneficiaries.